Oh my goodness, is it time for us to do our thing right now? I think it is.
Yep.
So let's go ahead and say hey to David. There's Dr. Klein, also known as Dr. Dave, also known as that guy.
All good.
All good. All right, so what are we talking about today, Doc?
We're going to talk about hormone replacement therapy only because COVID has me so terribly bored right now that I've got to talk about something else. You know, everybody has an opinion about COVID, okay, and most of the opinions are useless. So today we're going to talk about something else that's useless. Now, we're going to talk about how to maintain your health, how to get healthy, how to stay healthy, how to prevent a lot of these chronic illnesses that seem to make people get COVID. We're gonna figure out how to keep you healthy. How's that?
Really?
Hormone replacement therapy, bioidentical hormone replacement therapy.
Oh.
And it's not exactly what you think. Not that I know what you're thinking, but it probably isn't exactly what you're thinking. Yeah, he's going to talk about Premprone. No, I'm not. He's going to talk about hormone estrogens. No, I'm not. I'm going to talk about a bunch of things.
Okay.
All of which is hormone replacement.
30 seconds. That's okay. We have 30 seconds.
30 seconds. So I'll get another swig of this. Actually, this looks like water.
It is water.
It's water.
It's water.
I get to pretend sometimes.
Okay, so 30 seconds, and it's time for us to do the show. So I'm going to bail out of here, and it's all up to Doc. You're on your own,
I don't know how to work those knobs. Actually, I'll figure it out by the time you get back. No, so what we're going to do, okay, is we're going to look over the sorts of things that actually make life interesting for me. Here we go.
Welcome into another edition of Stages of Life on WDBO 107.3 FM and AM 580. We are live on this Sunday, so go ahead and join us, 844-580-WDBO. This is the show that's all about helping you feel better, be better, and, you know, just get on with your life. And a lot of times you have these ailments that you like to put off and think, this is nothing, it's not a big deal. Sometimes it could be a big deal if you do ignore it. Why don't you call right now and do some preventative damage instead of having to go and deal with something much further down the road. 844-580-WDBO. That's the number to give us a call right now, 844-580-9326. We are live, and Dr. Klein loves to hear from you guys, and you'll love to hear from him. 844-580-WDBO is the number. Of course, you can hit us up on our open mic feature as well in the WDBO app. Just click that open mic and go ahead and leave us a message, and we'll play that live on the air momentarily. But in the meantime, here he is, Dr. David Klein.
It is good to be here. And so what I wanted to discuss today is something that's I find to be fascinating. But more importantly, it's not COVID. Okay, I'm tired of talking about COVID. We've all heard about COVID. We all have opinions. We are just racked with all kinds of information, mostly misinformation, a lot of assumptions, and really nothing much has changed. People get sick. Everybody gets better. A good number of people never know they've been sick, and then we have a ton of people that are running around scared, and when they're not scared, they're rioting and looting. So what we're going to talk about today is hormone replacement and why it makes a difference. What is hormone replacement? Why do we care? Why do you care? What does it do for you? What doesn't it do for you? And what can you expect if you try it? And that's pretty much what I'm going to look at. And the first thing we're going to talk about is what is hormone replacement therapy. Before I do that, I'm going to dial back a little bit. The question is going to be, what's a hormone? What is a hormone? It's not an inconsequential question. Well, hormone is a chemical messenger, okay? But it does something very special. It induces a genetic change. Now, not a permanent change in your genes, but it causes a gene, which is a switch, to produce a protein. Glycoprotein, structural, any number of different sorts of events will happen following that gene being expressed or fired. As it turns out, it hits something called an effector zone. So what is it? It's a means and a mechanism that every cell in your body can communicate with every other cell. This is kind of like the ultimate town meeting. So your fat cells can communicate with your eyeballs can communicate with your throat, right on down the line. So when this communication system goes out of whack, wouldn't you know it, the symptoms are universal. Every system in your body goes sideways. So why should you care? Because a lot of people out there, most people in fact, feel that there's something wrong. And they feel that nobody can figure it out. They feel like, well, I'm not myself anymore. Ever since I turned 25, it's been downhill. And actually, that's true. It has been, hate to tell you. But there are things that you need to recognize and things you need to understand about this system. It breaks just the same as your wireless system at your house will break. Sometimes you have to go reboot the router. Sometimes you need to reboot the cable box. There are all kinds of things that have to be done to maintain the integrity of the wireless system. In the case of the human being, in the case of dogs and cats, in the case of all creatures, these hormones are very, very important. And there's a tremendous amount of overlap in terms of symptoms with regards to what happens if the level is too high or the level is too low. With hormones, they don't work single off. In other words, estradiol doesn't flip a switch to make your boobs bigger. It doesn't work. Testosterone doesn't make you manly like me. It doesn't work that way. Each of these things work as if they were numbers in a combination lock. So if you can imagine you were in high school, those of you that actually attended high school when it was time, now that they don't, this is going to be a meaningless metaphor, but you can walk down the hall and you see a stream of lockers. Each one has a 3-number combination on it, and each one's different. The right combination opens up your locker. With hormone replacement therapy, with hormone therapy period, in fact, with hormone health, these hormones have to be in the right balance in order for the lockers to open up. And I want you to imagine that you have 1,500 of these lockers. Each one has to open at the appropriate time. So it's almost like magical lockers. Ding, 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 ding. They open in sequence. They open as if it were a symphony. That would be the way the body operates. So when things go a little bit sideways, okay, a bunch of those lockers are not going to open on command. Isn't going to happen because you can't substitute progesterone for estradiol or estriol or estrone. 3 different hormones, 3 different estrogens. That's the way the body is set up. The wireless system is set up this way. But it's not just a matter of gonadotropin. So people say, well, hormone replacement therapy, that's estrogen. No, it isn't. That's only one of many different concerns. Well, that's testosterone if you're a guy. No, it's not. It's at least 15 other hormones have to be brought into balance or nothing works the way it's supposed to. So why is it that a diabetic, okay, is going to have problems with erectile dysfunction or neuropathy or mentation, oddly enough, or bone health, osteoporosis, heart disease, Alzheimer's? Why is that? Because insulin is called a hormone. And when it's out of whack, wouldn't you know it, other things don't work. Parathormone, interesting, DHEA, androstenedione, cortisol. If any of these things are not working properly, the body doesn't work well. And that's the lesson that has to be learned here. So the system, called, the endocrine system is fascinating. And there are all kinds of ways it can do well for you. And there are all kinds of ways that you as an individual can mess it up, okay? With your diet, it's a great way to do it. I have the capacity as a physician to heal. Not really, actually. What I do is I allow the body to heal. I teach, I drag, I cajole people into doing the right thing. If they do it, they generally do better. And if they don't, they generally don't do better. Very powerful. But you have the capacity. You, each and every one of the listeners here, has the capacity of doing the wrong thing and making yourself sick. And if you don't think that's a possibility, all right, drink a few too many beers and see how your body reacts the next day. Because ethanol is, in fact, a hormone. It does trip and trigger certain genes to fire. So technically, it's a hormone. It's a xenohormone. It's one that you bring in from the outside of the body, but it's a hormone nevertheless. What about things that inhibit hormone activity? You don't think those are important? Enzyme blockers, not the same thing, but hormone blockers are. So you can do damage, oddly enough, with a teaspoon of sugar. Fructose is a blocker of insulin. So when insulin goes up, wouldn't you know it, body becomes more inflamed, generally speaking, and then things start to go sideways. So what we're going to talk about in the next segment, okay, is not just what a hormone is, but we're going to talk about why you need to measure them, how you measure them, when you measure them, and then what do you do with the data once you have it. Because it doesn't do you a lick's bit of good, okay, to understand one thing without understanding the ramifications. It understands, you don't travel very well through life unless you know what your destination is. So our destination immediately is going to be What are we going to do with this data? Now that I know what hormone is, how do I make that work for me? And ignorance, oddly enough, is not bliss. What can I do? What can you do? What can they do? And what do we all do to trash the hormones? We'll talk about soy, thyroid. We'll talk about a bunch of things coming up in the next segment. So do we have anything cooking on the line there?
Yes, we do. And if you want to call in and ask a question to Doc, you can. 844-580-9326. That's 844-580-WDBO. Go ahead, give us a call right now. We got a bunch of open lines for you. But in the meantime, we're going to go to St. Cloud and talk with David. And actually, I'm interested for this question too, Doc, because my girlfriend's in a similar situation that David's wife is in. So, David, go ahead. What's your question for Dr. Klein?
I've listened to your show before, and several weeks back I had heard you talk about a type of cocktail that you were utilizing for people in order to try to help ward off the idea of catching COVID. My wife's a classroom teacher. She's going to be returning to school here shortly, and I thought of the idea that, perhaps maybe this is something she should look into, or the idea of going on like a hydroxychloroquine preventative type thing. They, are concerned that, things may happen. She does have some of the comorbidities that it would make me a little bit more concerned about it. So I was hoping if you can lead me in a direction to, help her.
Be happy to do it. Okay, well, the first thing is, that everybody, every person I ever meet has a comorbidity. Short of a child, you end up with something, whether that something is going to be asthma, whether that something is hypertension, whether that something is reflux esophagitis, diabetes, on down the line. It's not all the same thing. If you read down through that list, okay, you would think that everybody was at risk, yet we know that that's not true. So the first thing I'm going to do is I'm going to suggest that she understand and that you understand what COVID is all about. Coronavirus is something that has been around forever. The novel COVID-19 may or may not be so novel. We just haven't recognized it. So what is it? It's an enteric virus. It sits in the GI tract. How do we get it? We generally get this through the gastrointestinal tract, which, by the way, is why you don't want to be going to bars in particular. Let them open, okay? But just don't go, all right? Why? Because they don't clean their glassware the same way that you do at your house or the same way they do it in most restaurants. If they had, let's just say, dishwashers, it probably wouldn't be so bad. Or if they served their drinks in plastic cups, things wouldn't be so bad. So it's actually transmitted largely through the gastrointestinal tract. So how do you get it? You're going to get it at a meal. So the first thing I'm going to suggest that your wife do is not eat the food that's being served at the school. That'd be the very first thing I would ask her not to do. Bring your own lunch. Okay? Very, very easy. Resist the temptation to eat somebody else's donut. Resist the temptation that when somebody brings in a tray of bagels and cream cheese that you're going to indulge, because that is where she's most likely to pick it up. With regards to what other things does she want to do? Hand washing, simply the most important thing you're going to do, along with not touching your face, which is my hardest thing to keep myself from doing. I like touching my lips, whatever. It's just the way it works. You do that, you introduce a virus from the exterior to your gastrointestinal tract, then away you go. Third thing is you got to come off the PPIs and H2 blockers. These are things that cause your stomach to not secrete stomach acid. That stomach acid is there as a moat. Just as if your intestines were a castle, the moat protects you from the exterior. And when you take away the stomach acid, it doesn't take very much virus particles to pass through. So you know this, we all know this in medicine, because there's something called an inoculum size that's necessary to make somebody sick. So if you're taking, let's say, E. coli or Shigella, Salmonella, it may take 100,000 bacterium per ml to make you sick. But if you take away the stomach acid, it may be 1% of that. It makes you 100 times more likely to get food poisoning. That's what happens with COVID. So if you're taking omeprazole, Prilosec, you're taking Tagamet, you're taking any number of these things for reflux esophagitis, it puts you at increased risk, and that is probably the single most important let's say, comorbidity that you're looking for. Now, with regards to hydroxychloroquine, I prefer ivermectin. I think ivermectin is a better choice, but you don't do this prophylactically. You do it if you become sick enough and short of breath. Then these things seem to be very beneficial, but preventing the illness, no. But I'm not done with you, Dave. Okay? What I'd suggest is something called lactoferrin-containing colostrum, which, oddly enough, in nature is how mammals treat or prevent COVID virus in offspring. So if you've ever seen a calf being delivered or horse giving foal, or if you've seen childbirth, okay, you know that it's not the cleanest thing, that it's kind of a mess, let's say, a soupy mess. It is not sterile. The fact that the doctors and nurses are wearing caps and gowns doesn't make it anything more sterile than an average diaper. Okay, it's the way things go. So coronavirus is spread through poop. So what's the first thing that a mammal does after it's delivered? It goes straight for the colostrum. That's the first mother's milk. So I've been having my patients take freeze-dried, these are capsular forms of lactoferrin-containing colostrum. And about 8,000 patients so far, and we haven't had a single case of COVID, and we haven't had a single case of influenza in my patients that have taken it. That's a strong statement. So my entire staff is doing it. I'm doing it. My wife is doing it. Anybody that's got $34 that every 2 months, okay, is doing it. The stuff is dirt cheap. It's called lactoferrin-containing colostrum. Should she start to develop a cough or sneeze or anything like that, not all illnesses are COVID, believe it or not. Okay, your kids in the classroom are 5 times more likely to die of influenza than COVID. They're also 5 times more likely to get it. So what happens if you start to get sick? You take something called glyceric acid, and where do you get it? Licorice root extract. Licorice root extract is an antiviral. COVID is a virus. Okay, that's pretty much what happens. Plaquenil is an anti-inflammatory. It's very interesting. So if you've got, let's say, the pneumonitis that goes with coronavirus, it makes a lot of sense. But if you have a cough, it really makes no sense whatsoever. So did I go out and buy hydroxychloroquine for myself? The answer is no, I did not. But I do take the colostrum, and I do it every morning, and I take it every evening. My recommendation is typically to take 2 at bedtime. Why am I taking 2 in the morning, 2 in the evening? Because a little bit is good, more is better, and I bought it, okay? And I'm just going to go ahead and do it. The worst thing it's going to do is make me a little sleepy. So that's, David, what I think you need to do.
All right, good stuff, Doc. Appreciate it. 844-580-WDBO, 844-580-9326. Go ahead, give us a call. You listen to Stages of Life on WDBO 107.3 FM and AM 580.
Now, the 3 big things you need to know.
3.
I'll tell you something important about colostrum. They have McKinsey.
Hold on. You're just talking. We're here. We're on Facebook right now, so I've got some questions. Hold on. Here we go. Let me look. We answered the Rob question. Rob is doing as well as Rob can be at this time. Let's see. I have a 70-year-old man with mild asthma. Is it safe to take 15 milligrams of buspirone for anxiety?
You betcha. Buspar is really cool stuff. It's an anxiolytic. It's marvelous for panic attack. It's an adequate antidepressant, but it doesn't have any effect on the pulmonary system. There's no, let's just say there's no respiratory depression attached to it. It's safe with opiates and whatnot. It's not a bad thing.
Okay. All right. Iggy, how you doing? He says,
hey, Iggy.
I take bromelain every morning as per you, Dr. Dave, but I don't know what inflammation I am preventing.
Oh, there you go.
Is it joint related or
Yes.
is it cellular? Or am I on the wrong track altogether?
You're not on the wrong track, Iggy. Okay, it's marvelous with regards to things like blood clots. Okay, so if we give it to people if they get, let's say, surgery, because it will clear bruises and whatnot. So it's useful there. It's very, very useful for arthritis. Okay, it doesn't do too much good for vasculitis, other than the fact that if you develop a clot, it's helpful. So what are you doing with it? It all depends on what your goal is. I take it when my back hurts. Okay, so I have a herniated disc in my back. I take it and I feel better. I wake up in the middle of the night, back hurts. Man, I knock 2 down with a glass of water.
Cool, guys. How we all doing out there? Anyone tested positive for COVID?
You want to?
Anyone have it? Yeah, if you want to,
If you
just
want
go to
to.
one of those other.
Yeah, you can go to the box stores. Okay, in other words,
Stop.
if you we're gonna love this one. Okay, so if you go ahead and they send it into your insurance, you could get billed for as much as $250 for the PCR. So understand the nature of just send it to my insurance, because as of I think it was Friday, United Healthcare won't pay for it again. Period.
Yeah.
Blue Cross hasn't for a long time. I don't know that Aetna or Cigna have either. So you have to understand the prices of these things before you start going out and doing it. And we charge a little less than half of what the big boxes
Also,
do.
just a heads up that there is a scam out there that many of them, but one of them will say that someone has tested positive in your neighborhood. And then they'll use HIPAA laws and tell you they can't tell you who it is, but they will send you a test that you can take to confirm whether or not for the contact tracing. It'll only cost you $60. Well, wait a minute.
Yeah, there we go.
Yeah. Please don't be scammed by it. First of all, they're not going to call you and tell you to spend money. Okay. Second of all, be smarter than that. Please. Gosh. Can I take colostrum if I am lactose intolerant?
Yeah, generally speaking, it's not lactose is something that you see in milk, not necessarily in ice cream, and certainly not in cheese. The likelihood of finding it in colostrum is very, very small. Casein allergy is different. So if you're allergic to casein, there's a little bit of casein in it, but lactose probably not. And in fact, lactose intolerance and lactose allergy are two very, very different things.
How long, guys?
Yeah, and so with regards to the colostrum, it beats the heck out of getting the disease. If you're worrying about a little bit of inconsequential flatulence as opposed to maybe getting sick, it's really the way to go.
Yeah, right. I'll take a little gas.
Yeah, just don't,
Thanks, Kate, for checking in. You know what? Copy the link to this that you're watching, the video. Share it with your friends, if you will. That way they can also learn about stages of life. If you love Doc the way that we do, why not, right? Share the love. You know what's really cool about it is you won't be getting any infectious diseases or STDs or STSs out of this. Yeah.
Yeah. Well, that's kind of hard to. It's when you put that mask on, it's almost as good as a birth control.
It really is birth control. Yeah. Wow. Especially when you take it off and you see that there's like two teeth, summer teeth.
Well, really?
Have you ever seen that? Beautiful face. They whip it and like, hey, meth head. Whoa. No. Okay.
I've got patients in the office that say, hey, Doc, you mind if I take my mask off? I go, no, please don't.
No,
no, not for the disease. No, it's just a matter of aesthetics.
How long back at the Cox? I don't know. Nobody's listening to us back at the station.
This hour was paid for by the host.
Maybe it's now.
Reflect the opinion of WDBO. There's nothing typical about back to school this year, but that's not stopping us from helping over 20,000 children.
This is the challenge, okay, of not being in the studio to see what they're rolling down the.
Donate to our virtual school supply drive. Help make sure the first day of school
That may change shortly.
with WDBO 107.3 FM and AM 580.
On WDBO 107.3 FM and AM 580. Open phone lines for you, 844-580-WDBO, 844-580-9326, 844-580-WDBO, or hit us up on that open mic feature in the app. Just go ahead, WDBO app, and click that open mic feature. Let's go to the phone lines here. Carrie is calling in from Claremont. Carrie, welcome to the show. What's your question for Dr. Klein?
So ever since we've had to start wearing masks, I have developed this weird rash, almost inflammation, cracking, chapping, and it's all been in my nose and on the outside, and I can't seem to get it to go away with anything over the counter. I'm curious as to if it's a fungal infection, even though I wash my mask. I'm not sure. And the only other thing that could be is about a year and a half ago, I had a turbinoplasty done on my nose.
Sure.
And ever since then, my nose has been extra sensitive.
Okay. More than likely, what you're looking at is a contact dermatitis. Okay. You need to look at what you're washing the mask with. My advice to you is to start with a fresh mask and then wash it with just soap and water, let it dry and be done with it. But you can end up with a rash just like you do with when you change a detergent and wash your shirts or pants or something like that. Second thing, okay, is that it tends to get a little bit moist. Could it be a fungal infection? Yeah, the answer is yeah, it's a possibility, but it's far more likely that this is going to be a contact dermatitis. Now, what have you tried? What have you used? Medication-wise.
So I've tried Campho-Phenique. I've tried, I made a homemade Vicks with coconut oil. I've tried antifungal cream.
Which one?
I basically tried everything.
What antifungal did you use?
I can't remember the name.
Okay.
Remember the name?
Okay. What you may want to consider doing, okay, is getting yourself a different mask, okay, and see how things go. Because I don't know, sometimes the masks tend to break down a little bit, and then you have these little fibers and whatnot. They tend to be irritating. You find yourself scratching your nose. If it's going to be a fungal infection, what I'd like you to do is I'd like you to try something called gyne-lotrimin. Try that first. Gyne-lotrimin is something that should be familiar to you as a girl. Okay, it's sitting there in the GI itch department at the pharmacy. Try that first. If that does not work, you try one called Tinactin. If neither one of those two works, it's not going to be a fungal issue. So what do I think? I think that's contact dermatitis, but, okay. In the meantime, get yourself a fresh mask or a different mask. Try a different approach using maybe a paper mask instead of the cloth ones. And don't wash it with detergent. You don't need detergent. Just soap and water and let it air dry. And give that a whack. If that doesn't do it, give me a call back. But I really doubt that this is going to be fungal.
All right, appreciate that call, Carrie. 844-580-WDBO is our number. Go ahead, give us a call right now. The phone lines are open, 844-580-9326, 844-580-WDBO. Reminder, States like located at 1917 Booth Circle. And you can go ahead and give us a call right now and talk with Dr. David Klein at 844-580-WDBO. You're listening to Stages of Life on WDBO.
Oh, my nose used to get dry on the inside. I'm just going to say. I don't know what to say.
I don't know, Chris, are you there?
No, it's gone to the bottom of the hour.
Oh, good. Okay. It's hard to know.
Yeah, no, he's gone. Anyway, yeah, I used to get the dry and from air conditioners, just the dryness in the air, and then it gets irritated, and But I like the fact that you said put hoochie cream up your nose.
Well, it does. It works just fine. But if you're putting camphorphenique,
that's bad.
Pretty miserable.
That's bad. You're gonna. The fumes alone from camphor.
You're gonna do some damage.
I mean, I will give you that. Camphor works really good when you get those little corner of the mouth sores or whatever. It'll clear that up like that, but not up your nose.
Okay. Now, tea tree oil is a marvelous antifungal. It's also a marvelous antibacterial.
Yep.
But camphor, camphor like that, it's like witch hazel. You just don't put that in certain places, and that's one of them.
That is one of them. All right, boss, we got a couple of people who are asking when you're making the switch.
It'll be the first week in August is when we're going to be
double broadcast.
Double broadcasting. We'll be going 3 to 4 on one station, 4 to 5 on the second.
Mm-hmm.
And then after the third week in August, we're going to be straight away on FLA.
Okay.
So, we're still going to do this thing on Facebook, which I think is pretty cool.
It is. It actually is. We've got 18 people that are absolutely committed, and then you've got a bunch of drive-bys too that are like, oh, look at that, I know him.
Well, it's kind of hard to do this while you're driving, though. You got to admit.
I know people that do, and I could.
No kidding.
Yeah, I do. Yeah.
I thought I was the only one that watched TV while I drive.
I do, all the time. Yeah. So, anyway, just. You have any more questions for the doc right now?
Looks like we got somebody rolling up.
I'm looking on. Well, that's going to be on yours. How you guys doing out there? Everybody handling it?
Yeah, we do need to pick up where we were about the hormone replacement.
Oh yeah, hormone replacement. That'll be for. Well, you can start now, but then we'll get back on because you are. Well, as your signal wanes, you're getting less stacked decks here.
Oh, I got you. I know.
But,
I'm well aware of it. Yeah, we used to rack out 12 calls just straight down that list. So when they cut the strength of the signal by 70%, right in my backyard, it's like, what the heck?
Thanks, Iggy. Oh, I know. What?
But on FLA, it's a stronger signal.
It's very strong. Yeah,
so we should be better. You'll actually be able to hear me. Imagine that. I can't even hear myself in my own yard.
I know, that was kind of crazy. Do you recommend medication for subclinical hyperthyroid?
Yes. Okay. Subclinical hypothyroidism is in fact hypothyroidism. All right. So what are we looking at? You're looking at symptoms, clinical symptoms, sometimes worse than others. Doesn't necessarily mean that you're TSH, which is the thing that most doctors look at to say, well, you're hypothyroid or not. Mm-hmm. TSH is one of those sorts of things that requires enough estrogen to actually be secreted. So if you're a girl in particular, okay, and your TSH is normal and you're hypothyroid clinically, you replace the estrogen, all of a sudden the TSH goes up. Doesn't mean you became hypothyroid, it meant it unmasked it. So clinically hypothyroid, low temperature, depression, heavy irregular menstruation or not any menstruation at all, constipation. There's a lot of these things. Cholesterol going up. Elevated cholesterol is a symptom or sign typically of hypothyroidism. Blood pressure can go up. So each of these things happen from hypothyroidism, whether it's obvious to a clown or whether it's not. So, when things all line up, everything's exactly as you'd expect in the textbook, which is the rare presentation, by the way. Anybody can make the diagnosis. So subclinical hypothyroidism is not necessarily anything more than the fact that it doesn't have everything attached to it. A goiter, is a sign of hypothyroidism. So back in the day, if you had a goiter, you always treated a goiter with thyroid replacement. So how do you know if there's a goiter, you might ask? This little thing right here, because you hear me on Facebook, live Facebook. See this little dent here? It's called the suprasternal notch. When that disappears and you don't see it so much, that's the earliest thing to change with a goiter.
Ooh.
So you can look at somebody and go, hey, you got a goiter there, sweetheart. Well, what does that mean? It means that you're probably hypothyroid. Even if you're morbidly obese, you don't lose this. That's the way it goes. There's really not a lot of fat tissue here, but there's an awful lot of thyroid sitting there. So when this thing starts to swell, thyroid starts to swell, you lose that suprasternal notch. So look around. See if you're that person. See if there's somebody in your family that has that person or that problem. And then once we're done, so we've got a call that somebody wants to talk about pancreas. We could talk all day long about pancreas, but I still have to finish the discussion on the...
You got to do the HRT.
I got to finish the hormone thing, so don't go anywhere. I don't know if he's here, can hear me or not, because he's on the other line there. So
he can't.
Well, maybe we can.
Amy Caulfield's very upset. Apparently, an error by the Florida Department of Health produced COVID-19 positivity rates for children of 31%.
You think?
Course, which is not real.
Nonsense. Yeah, no kidding.
Really messed up a few decisions.
Well, they never make any mistakes there. But God help the doctor if they do. I got to tell you, they're a rather unforgiving lot, unless they make the mistake.
All right, and then it didn't happen.
That didn't happen.
Are we done?
Actually, I rather like those people. They're good people. They mean well, but they're also at the very end of the day, and the beginning of the day, in the middle of the day, state employees.
And civilian. Yeah, you know what they say about civilian employees in the military, right?
Yeah, right. Well, I know.
Thank you.
Welcome back to Stages of Life right here on WDBO 107.3 FM and AM 580. We're looking for you guys to hang out, ask some questions. Give us a call, 844-580-WDBO. What medical questions do you have for Doc? Go ahead and put them to the test.
Well, Chris?
580-WDBO, 844-580-9326. So I mentioned a way that you can get in touch with us is through the open mic feature in our WDBO app. The app is free. The open mic feature is right there on the front page when you open the app. And you can leave us a brief voicemail if you don't feel like calling in or just don't have the time to do it. We'll play it live on air like this one that we have right here. Go ahead and hit it.
Okay.
Hi, Doc. John from Melbourne Beach. I'd like to know any recommendations for those with rheumatoid arthritis.
Sure.
Recently got diagnosed, and they put me on Plaquenil. Any suggestions? Thanks.
All right. Rheumatoid arthritis is an autoimmune disorder. Just like so many other autoimmune disorders, there's a tremendous amount of overlap with other autoimmune diseases, such as diabetes, such as hypothyroidism, such as hypoadrenalism. The very first thing I would do would be to suggest to you that you get a cortisol level, an ACTH and a cortisol level, because they're going to start suppressing your adrenals, and then you're going to start getting sicker, and you're going to wonder why. So you need to get a baseline ACTH and cortisol now, before they start the prednisone. After they start the prednisone, you're kind of on a slide downwards. Vitamin D3 helps re-regulate the immune system. That is wickedly important. Third thing is you need to get into your micronutrients, because very frequently the immune system goes wonky or goes sideways as a result of micronutrient deficiencies. So I use a balanced chelate, a balanced mineral chelate called Magic Minerals. Why? Because I have autoimmune thyroid disease, very, very similar problem. Periodically, my cortisol level drops, and when I do, I'll supplement it a little bit. My wife has to supplement it more than I do, actually, because she's had this issue for a lot longer. So first thing I would do would be vitamin D3, the chelated minerals. I would be checking yourself for autoimmune thyroid disease. I'd be checking yourself for adrenal dysfunction, because it may well be something as simple as that, and which is going to lead me into the rest of my discussion, which is going to be the rest of hormone replacement therapy. Then we'll pick up the folks on the line, because we have to pick them up also. So what I wanted to do was to go over, what do you do with regards to the hormone replacement therapy, or just, thyroid disease, gonadal disease, insulin disease. You have to check these things by looking at the blood work. What do hormones do, and how do they transmit their messages to each other? And it goes by way of the bloodstream, not by way of saliva, not by way of urine, not by way of teardrops. It goes by way of the bloodstream. So you can check the levels in the bloodstream, and it's very much like doing what I'm doing right now, which is speaking into a microphone. If you wanted to hear my voice with clarity, with certainty, you put the microphone close to the mouth. If you want to hear a garble, you stick it on the other side of a wall. And that's what happens if you don't check these levels through bloodstream. So people are out there doing this stuff by saliva all the time, and it's a joke because you can't get real-time data by looking at what the salivary glands think might be going on. Now, wouldn't you know it? Fat cells secrete estrogen. Okay, go figure that one out. So if you were sampling it from a fat cell, what's going on in your bloodstream, you'd be getting elevations in estrogen. So nobody has ever really proven that salivary glands are the master glands for checking out hormone therapy. So blood work is the key to this business. So what is it all about? Okay, so if you have inadequate or imbalance of testosterone and estrogen in a man, you start losing your masculinity. You start losing your muscle definition. You start losing your edge, your ability to concentrate. You lose your decisiveness. You start crying, at midday, what do you call them, daytime drama. You start having an urge to watch Oprah. Okay, it takes estrogen to watch Oprah. I got to tell you, it takes an antiemetic too. So what are you looking for? Thyroid hormone, because hypothyroidism leads, oddly enough, to hypogonadism. That means low estrogen, low testosterone, low progesterone to women. So what else can go on? So if you have a thyroid issue, parathyroid problems can ensue. And when that occurs, then you see osteoporosis. Hypothyroidism can cause osteoporosis. They say, well, but if you give too much thyroid, it can cause osteoporosis. That's utter nonsense. It's a big difference from inflammatory thyroid disease causing osteoporosis and then somebody actually treating it. And I see that all the time. It's kind of like a world of ignorance that's out there. So what do you do? First thing you do is you want to understand that if you don't correct these things when you're young, the bones melt away and they don't easily come back. In fact, they don't typically come back at all. So if you're not looking at estrogen levels as a female and they decrease with age, you're going to develop osteoporosis, osteopenia, and you're going to start crumbling. You start losing height. Wouldn't you know it? Mom used to be taller. No kidding. She used to be taller. Well, what do you suppose happens when the spine starts to collapse on itself? The nerves start to get pinched. That's called pain. Okay, so if you want chronic pain for the rest of your life and support a guy like me, that's how I earn my living, then you don't pay attention to these things when you're young. If you're concerned about things like cancer, well, they said that estrogen causes cancer. If it caused cancer, you'd see elevations of cancer in young people. The average 15-year-old has astronomical estrogen levels, but an extraordinarily low risk of cancer. You take an old lady with hair on their face, those folks have no estrogen and a higher risk. So in terms of common sense, if it caused cancer, it would have caused it. If it's not there, how does it cause it? It doesn't. In men, it's the same thing, except, wouldn't you know it, estrogen levels climb with age. Testosterone tends to decrease. So why are they having trouble and prostate cancer? Because the estrogen levels increase in prostate mass. So these things have to be dealt with, both men and women. Thyroid disease, adrenal disease, that's cortisol, DHEA, pregnenolone. No, if you don't, let's say your adrenals start to diminish. Okay, that's very, very common. You start seeing treatable dementia. So maybe grandma and grandpa aren't really all that goofy. Maybe they're just hypoadrenal, and you could fix it for maybe $20 a month. That's the sort of thing that you have to look for. So if you can't afford to have this thing checked, you can't afford that RV. You can't really afford having your hair done, your nails done. You can't go out to get those extra pizzas because that's all it costs to actually figure out what's wrong with you. So what does it cost to treat somebody? About $12, $15, $20 a month for thyroid. What does it really cost to treat somebody for adrenal disease? About $30 a month. What does it really cost to treat somebody that's testicular? Okay, the answer is in my practice about $26 a month. That is not a ton of money, but it doesn't come for free. Nothing comes for free unless you go to the VA, in which case they don't do much of anything for you except to kind of amuse you in the waiting room. So what do I suggest that you do? And that's to actually adult on this thing and understand that you're not going to get everything for nothing unless you think like they do in Seattle and Portland and whatnot. And then you can go out there and steal it. So let's go to the phone. Let's talk about a pancreas. What do you think, Chris?
I think that sounds like a good idea. I mean, I enjoy listening to you anything with that's really interesting because I'm kind of you talked about how when you hit that 25 age, things start to happen.
Well, we've
I've
talked about
noticed
that, haven't we?
28, so it's good stuff, Doc. All right, let's go to George. He's calling in from Orlando. George, what's going on? How you doing?
Hey, Doc.
George, how are you doing?
You need to find you like a 56 caddy with those big Dagmars that we talked about.
Well, the 59 is one of my favorites, but I'll tell you what, if I could find a 54 Eldorado, I'd be all over it.
Oh, man.
Nice car.
Hey, Doc, you know that Louise Dagmar, made the cover of Life magazine in 1951.
Yeah?
Yeah.
Okay.
She was quite something. Anyway.
So what you got, George?
Oh, yeah. Yeah, you got to look it up.
All right.
My sister-in-law, my first one, has pancreatic cancer. They found 2 tumors.
All right.
Can you talk a little bit about that?
Yeah, pancreatic cancer, okay, is a disaster. It's a terrible, terrible, terrible problem. Generally speaking, by the time you find it, it's already too late to do much with it. And that's a very, very unfortunate cancer to have. You know, Alex Trebek has this sort of thing. It's just a miserable, miserable problem. There's some things that you can do to maintain some of the function, at least longer. What I usually do is I put people on a combination of N-acetylcysteine, sometimes known as NAC. The dosage is 500 milligrams 4 times daily, with guaifenesin, 400 milligrams 4 times daily. What that does is it thins out the pancreatic secretions so that the swelling doesn't get quite so bad. But the prognosis for pancreatic cancer is not generally very good. It's a rare bird indeed when you can go in there and do a pancreatectomy. That's removal of portions of the pancreas and actually save somebody's life. So, George, you just did not make my day with that one, and I'm so terribly sorry. But that's one of those circumstances that makes everybody very, very nervous and very unhappy.
I appreciate that, George. Yeah, that's tough.
That's a bad one.
Going along here, we're going to go to Claremont and talk with Bill.
God, I love Claremont.
Bill, welcome to the show. What's your question for Dr. Klein?
Hello, thank you. Hey, I'd like to go visit my dad. He's elderly. He's 92, and he lives in Oregon. So it's about a 6-hour plane ride each way. Obviously worried about affecting him. My family is dead set against me going there because of the COVID risks. My daughter also, she has type 1 diabetes, so she feels she's compromised anyway. Do you have any suggestions for minimizing the risk, or should I just put this trip off altogether?
Well, Bill, if you were my patient, I would suggest that you put it off, okay? Because there are a couple things about this that are problematic. One, the 6-hour plane ride is going to put you in direct proximity with a bunch of people going, a bunch of people coming, all breathing the same air for a long period of time. So if you look around the plane, if you spot anybody in there that you wouldn't want to kiss, you're probably in the wrong place. Okay? Does that kind of make sense? Second thing is that when you're in the airport, you're going to be there all day. You're going to be eating in places you would never otherwise eat, sitting on surfaces, leaning on surfaces, and touching surfaces that have been touched by 1,000 people before you that day. It's exactly where I would not go if I were, if I didn't plan to get sick. And then the worst thing, okay, is that you're going to need to get tested a day or two before you go, and you're going to need to get tested a day or two before you come home. Otherwise, you're going to be met with some resistance at the airport because they're not just letting anybody come through these states anymore. So what do I think? We are now in, quote unquote, the statistical epicenter of COVID in the country. Now, I don't see people dying under bridges here, okay, frankly. But, okay, there are a lot of people that are coming down with the illness, and we're seeing between 6 and 7% positivity rate on the tests that we do, okay, at Stages and at Florida Laboratory. So we're doing between 1,000 and 1,800 tests per day. So positivity is 6 or 7%. That's not that terribly high. But somebody that may be at risk, like your dad, okay, it may be the kiss of death for them. So I would be looking for something like Zooming, that little deal where you can do on the virtual visits and whatnot, And then if this thing passes, okay, this coronavirus issue, then plan to go out that way. But flying on an airplane is not something that I would be doing personally, and I don't have any comorbidities that I think would put me at risk. But I also don't push my bets, and I would ask you, Bill, not to push yours. I hope that answered your question. Yeah.
Especially with those numbers, Doc, too, like you're talking about. And I get the positivity percentages in high, but everyone coming from all different parts of Orlando to get to that airport.
They're not even coming from Orlando.
Concentrated in one area.
They're coming from all over the place. Okay, so if the incidence is 6 to 10%, depending upon where you are in the state, 14% if you're in Miami. And now last time I was in Orlando Airport, okay, there were people coming in from Miami to go across the country. That's just the way that it works. So if you have a plane there that has more than 20 people in it, odds are you're going to get sprayed by somebody who's sick. That's it. 1 in 20. 1 in 10 if you're from Miami. So think about that. You think you're the only one on that airplane, or the only one that's been on that airplane all day long? Do you think they clean, the trays and the commodes and everything every time somebody touches it? The answer is negatory, Batman. Don't go. Okay.
Yeah. How much you can trust yourself to take so many precautions, but how much can you trust all those strangers around you?
I don't trust anybody.
Good stuff, Doc. Good stuff. 844-580-WDBO. That's some good stuff, Doc. 844-580-9326. We're going to hit Jim in Orlando coming up, but we're going to get you with the 3 big things you need to know. You're listening to Stages of Life on WDBO 107.3 FM.
All right, looks like we got Gerald checking in. Gerald, and he says that he listens in Deltona and that he got totally screwed out of listening to the station since they changed the frequency.
Yeah.
Just glad you're going to a new station. Deltona, you should be able to hear us on 94.1 FM next week with no problem.
Starting next week.
Yeah.
And it's going to be a little bit, it'll be a little different. We'll have different bump music. We're going to have a good time with it.
Yeah, I'll be hosting it with him, so that'll be more fun.
So next week it's a 2-hour show. So if you pull in on Facebook, you get 2 full hours of my nonsense.
2.
Yeah, that's a twofer. It's a double header.
Yeah, that's kind of crazy. By the way, hi. In case you're wondering who's talking, that's me. Okay, so here we go. Why would hyperthyroid symptoms get worse after the slightest medication increase? 25 microsynthroid to 37.5.
Okay, because it's brilliant question, and it makes all the sense in the world. Synthroid Levoxyl is actually a pro-hormone. All right, you're going to think, what the heck is he talking about? It's inactive, but it's also an antagonist of the active hormone, which is T3. All right, so one of the ways you can take somebody that's hyperthyroid and settle them down is by giving them Levoxyl or Synthroid. So very cool trick. So what you're observing is the same thing that most anybody that's on this medicine knows, and that's why I don't prescribe it. So if you're on Synthroid and you need to increase the level, you take something called Cytomel or liothyronine with it. The T3 that's in the Cytomel is actually the hot sauce that you need to make things work. Or you do as I do, because I'm a cheap sucker, is I take NatureThroid, which has both T3 and T4 in it. And then when you increase it, you're actually increasing the T3 level, which is what the active hormone looks like. So, but that makes all the sense in the world. Well, my TSH went up, so they went ahead and gave me more Synthroid, and I feel sicker. So generally speaking, I fill my office waiting room is filled with people, okay, filled with it, okay, that couldn't convince their doctor to use something other than Synthroid because that's all they know to do. That is the answer to your question, is that you, I think, are smarter than your doctor. Brilliant question. What else we got up there?
What channel is News Radio WFLA on? I would like to tune in. I've always listened on 96.5, but since they made the big change, I'm not happy with it. I can't pick up 107.3 station and 580 sounds awful. I am so glad I got the notification for the doctor on Facebook Live. Now, the notification that you're talking about is the little bell on the right side of the video. If you've clicked on the video, click on the bell, and then that'll notify you anytime that the doctor goes live for Stages of Life. Because every other Thursday night, he's also live with the Connections Relationship Radio Show, helping us learn about health and well-being as well. So
yeah, it's a different show. It's
totally
a different
environment.
Yeah, it's a whole lot looser. This I have to be very, very tight.
Right.
Very professional looking.
Oh,
or at least professional sounding. Mm-hmm. So, but yeah, it's great. And they gave me 2 days notice when they were going to change it from 96.5 to 107. Yeah. It was like, you got to be kidding me.
Mike said he'll be glad to have the 2 hours back. See, a lot of people do miss the fact that
I used to be on 2 hours.
3 hours.
3 hours at one time. Then I started getting older. Wait a second here. You know, 7 days a week, I need at
And
least 2
then he
hours of
met
rest.
Tess.
Well, Tess made me stop.
Yeah. Don't blame it on her. She's
I
over
can.
there going, that ain't right.
No, it's just
That's
true. Actually,
not
I
right.
quit it before I started seeing Tess.
Yeah.
So
Kate, that was a great question about the Synthroid.
yeah, I mean, truly, that's typical, actually. Well, they gave me more Synthroid. It brought my TSH down, but it makes me feel worse.
Yeah.
So
it can.
It does.
Really can.
It's very routine.
So anyway, I want to thank everybody for finding us on Facebook, Stages of Life Medical. Pass it along. We're also on Periscope, broadcasting on the Connections page. And every once in a while, LinkedIn puts us up. I don't know what that's all about. And, of course, we're on
LinkedIn, really?
YouTube
How
as
cool
well.
is that? As long as TikTok doesn't do it, I'm
no,
good to go.
I don't mess with that. And we're also on YouTube, both Stages of Life Medical Center, our Medical Institute, and Connections is on there as well.
Yeah, we have about 200 YouTubes that I'm going to ask Melissa to put up on the FLA, these web blogs or whatever.
Talking
they're
about
called.
the iHeart podcast.
Podcasts. So, but I've got several hundred of them, and by and
we'll
large,
work
they're
on it.
interesting. I think they're interesting.
Oh, can you change your diet, AIP diet for Hashimoto's and hypothyroid systems to get better or lower TSH and antibodies?
Yes, indeedy. Okay, now how do you make somebody who doesn't have hypothyroidism hypothyroid? You give them soy isoflavones. So the first thing that you can do to make somebody sick with autoimmune thyroid disease, sometimes known as Hashimoto's, is to take soy isoflavones. Daidzein and genistein are their names, but you can get it in soybean oil, but soy lecithin is the main actor. You do that, you're going to get sicker. Second thing you need to do is to make sure that you have enough zinc and selenium in your diet. Okay, if you have zinc and selenium, it tends to downregulate the immune system a little bit, makes the thyroid work better. Vitamin D3 is terribly necessary as well. N-acetylcysteine, or NAC, you'll hear me talk about a lot. NAC is an antioxidant, but it's also a free radical scavenger. When you have thyroiditis, especially Hashimoto's, okay?
Thank you.
This is
We'll get back to you.
107.3 FM and AM 580, Orlando's news and talk.
Welcome back to Stages of Life on WDBO 107.3 FM and AM 580. To Orlando we go. Jim is calling in. Jim, welcome on the show. What's your question for Dr. Klein?
Hey, doctor. I'm having a bit of problem with twitching in my chin and a little bit of twitching in my right eye. I have cut out all caffeine and tried some magnesium. Is there anything you can suggest?
Yeah, the first thing that's going on here is you have a facial nerve irritation, okay? So is it on one side or both sides? Jim?
It's a little bit underneath my right eyelid, and it's in my cheek, like
Okay.
the chin. I'm sorry, not the cheek. The chin. It's in my chin, both sides.
The nerve that's been irritated, okay, is actually, believe it or not, is just in front of your ear, but it's called the facial nerve, okay, or the seventh cranial nerve. There are 5 branches of this, one of which goes up around the eye and temple, and one that goes down into the chin area. There's another one that goes down to the neck. So one of several things is going on here. Okay, so either the nerve is being irritated by the parotid gland on that side, so you may end up with an irritation of the parotid gland. You'll know that this is a problem because you may find yourself dryness in the mouth. You may have a fetid or an odd odor to your breath. Okay, and if that's the case, then infection of the parotid gland can lead to this. But also trauma to the face can do it. So if you found yourself sleeping on your face, leaning into your hand, it can cause this. The way I typically treat it, okay, it's very, very easy. It's with a topical anticonvulsant, which is a mixture of gabapentin with ketoprofen and what's called pluronic lecithin in wrench anhydraspase. Pardon me, I almost gave you the wrong base. And so what this is, it goes straight for the nerve, settles it down very, very quickly, and it will resolve this. Okay, very, very interesting, very common problem. Sometimes it can be made a little bit worse with caffeine. Sometimes it can be made a little bit worse with salt. But generally, it's an inflammatory, irritative process that was either traumatic in nature or infectious in the parotid gland. And that's something that should be looked at. Okay, why? Because if it's parotid gland, you need to fix it.
All right, there we go. Good stuff, Jim. And Doc, we've got about 2 minutes left here. Why don't you go ahead just go ahead and let everyone know where they can contact you and, the telehealth, what you're able to do at the office right now.
Sure. Okay, we are in Longwood, Florida, which is a piano's throw off of I-4 at 434. Okay, we can be reached at 407-679-3337. That's 407-679-3337. Ask for Iris. Say, Iris, I'd like you very much to set up an appointment for you. We can be evaluated. You can come shop us on suffernomore.com. You can look us over at stagesoflifevitamins.com and see what we do and how we do it. But again, 407-679-3337. And if you just want to come over and look us over, we take visitors, believe it or not. We do the telehealth thing, but I really prefer to see people in person. Bring your mask with you, and we are only too happy to show you around.
All right, great stuff there, Doc. Appreciate it. Everyone tuning in to Stages of Life. Great calls today. We'll be back again from 3 to 4 p.m. next week here on WDBO 107.3 FM and AM 580 Orlando.
Hey guys, everyone, thank you so much for joining us all. We are done for now, but we'll see you next week. Dave, any parting words?
None whatsoever, except be well, keep your face covered, and that way people don't know it when you're smiling at them.
Or sticking your tongue out.